What I wanted to explain this morning was my injection pattern for doing Botox to relax the muscles of expression around the face. Botox, as many of you are aware, has been available for the last 10 to 12 years for cosmetic use. In fact, Canada was the first country in the Western world in which Botox was released on the market for cosmetic use. The product itself has been available since 1989 and has had many medical uses over the time period. When we use Botox, its main purpose is to relax the muscles. So this is something to relax the muscles. Typically it takes anywhere between 3 to 5, maybe even up to 7 days for it to have its full effect. And when we inject Botox into the muscle expression around the face, usually we get anywhere between 80 to 90% relaxation. Most people are concerned that they do not want to look expressionless, and we try to tailor our treatments such that they still have a certain amount of movement and they do not look plastic-like or expressionless. The commonest areas that we inject Botox are usually in the center part of the forehead. This is what we call the glabellar region, so we inject typically here in these spots, as well as in the forehead region to relax some of the muscles of expression up here, typically around the crow's feet, and in some individuals we will inject around the chin or around the corners of the mouth in order to prevent some of the down pulling on the corners of the mouth and to correct that area. Other areas that can be injected are around the lips as well as around the nose and the bunny lines in the nose. But the typical areas, and in fact in the majority of individuals where I use Botox, the commonest areas are the center part of the face as well as around the crow's feet area. Usually with many people we will put on a topical anesthetic first, which will numb the area. Usually it takes about 20 minutes, 20 to 25 minutes, and that minimizes any degree of discomfort that people may feel. But most people with Botox, generally speaking, feel relatively little discomfort with the injections. So what we're going to do with Debbie here is I'm going to get you to frown first as hard as you can. So Debbie's last injection of Botox was approximately 3.5 months ago, and that is the typical duration of effect of Botox when it's used. So what we're going to do is we're going to relax these muscles, and there's 5 injection spots that we use. So what we're going to do is we're going to inject a little bit of Botox right here, and that will relax the muscle that is pulling down in this area, which frequently causes the little lines between the bridge of the nose and the forehead. We're going to inject what we call the corrugator muscles here, and you notice that I usually pinch a little bit. The reason for pinching is again to minimize any discomfort in this area. And then continuing on, we will inject a little bit up here, and finally we will inject a little bit on the side. And this is the area that most women love because it will give them an eyebrow lift. And then similarly we'll do the same on the other side here. After that, the other main area of injection is around the crow's feet. So we're going to inject here. And there's usually either 2 or 3 areas that we inject to relax the muscles that surround the eye and which are responsible for causing the crow's feet to develop. Now I'll come over to the other side and inject this area here again. And again the crow's feet. With this injection technique, there's usually very little in the way of side effects. Occasionally individuals may have a small little bruise, but that's uncommon. It will usually disappear within 7 to 10 days. In a very small percentage of individuals, there may be a little bit of a drooping of the eyebrow. That happens in usually less than 1 in 500 individuals, and it will resolve on its own over a period of 2 or 3 weeks. Finally, the last area that we inject is up in the forehead area. And Debbie, if you can just look way up for me, and you can see how the muscle lines are going going across the forehead. And you can see here how the lines are crossing the forehead, and so we're going to inject these areas to relax this area as well. And again, typically it is a series of 4 or 5 injections. Now the effects of the Botox should take place within 3 to 5 days, and she will probably return back in another 3 or 4 months to have another injection pattern. So most individuals that get Botox injections typically have it injected 3 to 4 times.